I am Dr. Giles. I am an ophthalmologist. I take care of eyes. I do the whole spectrum of eye care. I do routine comprehensive eye examinations from children all the way to the elderly. That includes prescribing glasses, fitting contacts, doing minor eye problems. But unlike optometrists, I also take care of serious eye problems. I do laser for glaucoma, for diabetic retinopathy. I do cataract surgery. I'm an IMD. I was exposed to medicine as a young child by both my grandmother, who was a nurse and was the first woman of the year in Griffin. I was also exposed by my father, who was a general surgeon. When I went off to Emory, I got a job as an orderly at the University of Emory Hospital. During the summer, I got the opportunity to watch a lot of surgery, and while watching surgery, I became very interested in ophthalmological surgery, and that's when I decided I wanted to be an ophthalmologist. Our optical department is well staffed with two well-qualified opticians that have many years of experience, which is probably the most important thing that you need when you're going to get some new glasses. We also have an extensive collection of frames, and we have a very good laboratory that does our lenses. Too many people think they need an eye exam only if their glasses are damaged or they're having a little trouble seeing. In actual fact, any diabetic needs an eye examination at least every year, and once you get much past the age of 50, you need an eye examination every couple of years to pick up silent threats such as glaucoma and macular disease. Our refraction system is designed to make it much easier for the patient to come up with a prescription they'll be happy with. We basically have a system that will measure their present glasses and put it into the computer. We then have a system that will measure their prescription without the patient having to say anything and put it in the computer. We then will ask the patient questions as to what prescription works best for them, and that will be put into the computer. Then, using all of this input and getting feedback from the patient, we will select what the patient prefers best and then give the patient the opportunity to compare this to their present prescription of glasses and then decide whether or not there's enough difference between the new prescription and their present pair of glasses to make it worthwhile for them to buy a new pair of glasses. This is a special laser that is used to treat glaucoma. Because of its frequency and extremely short exposure times, it really just doesn't generate heat. And because of that, there are no burns in the eye. It is used to treat patients that have difficulty with drops. In many patients, they can eliminate the use of drops. I also have available an argon laser. That is a hot laser. It is used to treat people that have diabetic retinopathy, that have retinal tears, that have other problems with the retina that can be alleviated with the use of the argon laser. This is the Stratus OCT. It uses reflected coherent light to form a cross-sectional image of tissue in the back of the eye. It is very useful for diagnosing glaucoma, especially in hard-to-diagnose cases. It also is very useful in looking at the retina and evaluating macular disease. Also in glaucoma, it is used to follow glaucoma so that you can evaluate whether or not patients are getting worse or not and adjust the treatment accordingly. I have a tennis court in my backyard. I love to play tennis. When I was at Emory, I played on the tennis team. When I was in the Navy, I played in a lot of tournaments and won a couple of tournaments for my division in the Navy, and I love to play tennis. I am Dr. Giles, and I am PAPP Clinic.